Copyright Harrison 2020. What I'd like to do today is kind of a special topics lecture on emotion. I'd like to cover the primary, most popular theories of emotion. And I would like to, in so doing, I'd like to share one line of research in the Behavioral Neuroscience Lab here at Virginia Tech. And that particular line of research is on emotion theory, but it's specifically focused on the violent, prone, angry, hostile, cynical folks. And so the goal here sorry for the delay there. One of the things I'd like you to appreciate, if you can, is that many of our attributions towards emotion and emotional processes are very likely incorrect. They're characteristically attributions made by your left brain. They're logical, they're linguistic, but our science suggests that many of these attributions are incorrect. We have different circuits in the brain that process different emotional valences. This is a classic example here. I have switched these images over so that they would be easier for you, and that probably will mess you up. But this is our right brain over here on this side. This is the same individual, but this individual has had a stroke in the right lentiform bodies. You'll remember the lentiform bodies include the putamen and the globus pallidus. And if you were to add the caudate, then we would refer to them collectively as the basal ganglia. But a right lentiform lesion produced spastic crying, and this was discovered by Constantini in 1910, first one to document it. But similarly, a left-sided lentiform lesion or a bilateral lentiform lesion will oftentimes produce gelastic lability or uncontrolled laughter, spastic laughter, and you'll experience that functionally perhaps as you go into final exams. Each year our faculty and students are under tremendous stress on this circuit, and you'll find them laughing more than they normally would. And so here we have a clear lesion, and that helps us learn about this system. But in day-to-day life, it's the amount of weight that we put on the circuit. It's only capable of processing so much, and that is our capacity theory from your laboratory, our B&L here at Virginia Tech. But we had replication and related findings on this circuit. And then you'll recall we discussed Delgado, who was placing electrodes in different circuits in the brain, and notably to control anger or aggression in a bull in Cordoba, Spain. But as the bull began to attack him aggressively, he pacified that bull. But that circuit tends to be at the base of the right frontal lobe, what we call the orbitofrontal region. So let's begin with emotion theory, and we can basically divide them into two major categories. The right hemisphere theory of emotion. There's almost universal agreement to this theory. It's very unusual in science to have such a collective appreciation that the theory has good basis. Your right brain is viewed as being dominant or preeminent in processing emotion, especially negative emotions like anger, sadness, fear, but any intense emotion like very robust happiness and things like that. And the bihemispheric theories, here we're looking at the role of the left brain in contributing usually happy emotion. Happy is the only emotion, broadly defined of course, includes interest and things like that, and approach-related motivation. Whereas negative emotion would be attributed to the right brain. So right hemisphere theory now, the right brain is viewed oftentimes as being the emotional brain, and the anatomy here is that the frontal lobes are inhibitory over the systems in the back of the brain via all of these U connectors. So different parts of your frontal lobe inhibit different parts of the back of your brain. So the posterior part of your brain, every sensory modality goes back there. So if you're looking at an emotional face or hearing an emotional musical melody, or if you're feeling emotion throughout your body, that's viewed as being comprehended and analyzed in the back of the brain. And your frontal lobe is regulatory over that. It's inhibitory over those emotional feelings. Again, general rule of thumb, the frontal lobes are involved in the inhibition of reflexes and over regulatory control. Balance and valence theories I'll discuss next very briefly, just an introduction. These are basically the same theories, I would argue. However, when we talk about valence, we're adding emotional valence to the balance theory. So if we're talking about happy or sad or angry valences, then we might call it the valence theory. The balance theory is basically that these two brains are in oppositional aspects, one towards the other, and that in any particular stable situation, we're seeking balance between them. But if someone honks at you and curses at you in your car, then that may activate your right brain and alter the balance somewhat. And so we'd expect then the right brain to inhibit the viewpoints of the left brain, of logic and language, etc., and make it a little bit harder to understand logical reasoning. So this theory now predicts that positive emotion occurs with left frontal activation. So for example, a baby seeing its mother and maybe a nice smile from the baby to its dad, we would expect left frontal activation. With right frontal activation, we expect negative emotion. And I think I've seen this fellow maybe selling hamburgers at McDonald's the other day. Anyway, watch out for him. Kind of looks like a leprechaun, doesn't he? So another very popular theory, especially in our department here at Virginia Tech, many of the faculty members investigate the BISBAS theory, behavioral activation theory, but I'm going to put it together with approach withdrawal theory. And here the theory predicts that left frontal activation is associated with positive emotions and approach-related motivation. So in economics, we might be looking at product marketing that will activate the left frontal region to increase the likelihood of us buying a product or wanting something. And instead, right frontal activation occurs with negative emotion and withdrawal. Manic's theory is worth mentioning here. Here, left frontal activation for Manic was associated with optimistic anticipation of future events, whereas right frontal activation was associated with negative reflection on past events or failures or insults, those types of things. And you all can appreciate that some folks ruminate or tend to stick on certain views, either negative reflection or optimistic anticipation. Dominance and submission theory is from our laboratory here at Virginia Tech, and we've proffered that left frontal activation is associated with feelings of dominance, that you will win, high energy level, all of those types of things. Right frontal activation instead is associated with submissiveness or defensive behaviors of feeling like you're going to be losing or beaten. So you can imagine in our sports psychology, we want to find things that will activate our football players, basketball players, volleyball gals, soccer gals, their left frontal lobe for high energy level, a feeling that you cannot be beat, a feeling that you're going to win. Now, so again, we have two major types of theories. We have right hemisphere theory of emotion, and then we have balance theories, where we consider the contributions of both brains. But what we attempted to do in our quadrant theory here at Virginia Tech was to put those theories together. Almost all of the research on balance theory has been on the frontal lobe. And on right hemisphere theory, it's almost all been on this cable here, the longitudinal tract. Again, many different euconnectors, but collectively form the longitudinal tract where the frontal lobe can regulate what's going on in the back of the brain. So balance theory says that if we activate the right frontal lobe, that we will downregulate or inhibit the left frontal lobe. But right hemisphere theory says if we activate the right frontal lobe, that we will downregulate or inhibit these negative perceptual systems in the back of the right hemisphere. And that allows us for the first time to make predictions for this area here, where in science we have almost no literatures. But with downregulation of the back of the right brain, we expect release of the processing mechanisms here in the back of the left brain. But you can imagine now we get different permutations with this theory. One of the primary theories that I did not mention on emotion has posited that there is a relationship between the left frontal lobe and the back of the right brain for any type of emotional disorders like anxiety and things like that. But that was a clue that we needed better theoretical development here, such as the quadrant theory, because there's no anatomical connection that's diagonal in your brain. But we can get to the relationship between the left frontal lobe and the back of your right brain using quadrant theory, where if we have increased activation of the left frontal lobe, we downregulate the back of the left brain, the logical linguistic processing, and that produces a release of the back of the right brain, an emotional take, and maybe a negative emotional bias on the setting. Anyway, quadrant theory. This is my favorite theory from our laboratory here at Virginia Tech, and it's got a good bit of weight now as other laboratories have jumped onto the bandwagon. But basically in this theory, we are arguing that the other theories are somewhat incorrect based upon the types of methods that we're able to use in science. For example, I'm a member of the IRB board, Institutional Review Board, and we will not allow you, if we do our job, we will not allow you to push people beyond certain limitations. So almost all of our science on emotion or stress has been on mild and maybe a little bit of moderate stress. But in life, we oftentimes have extreme stress. So in science, if we're looking at mild right frontal stress, maybe a little bit of negative threat out there in your environment, maybe a social situation that's uncomfortable. As the other theories, balance theory, for example, predicts, your right frontal lobe will activate to keep your emotional processing systems in the back of your right brain under control. But what happens when you exceed the capacity of the right frontal region to limit negative processing? Well, in extreme stress situations, capacity theory predicts that the right frontal lobe will shut down to protect itself and leave the back of your brain, back of your right brain, unbridled. An analogy, if you allow me, might be with a muscle, maybe my bicep in my left arm. If I put stress on that muscle, then I will counteract that stress. For example, if a weight is put in my left hand, my bicep will activate in order to regulate that stress. But in situations where that muscle is in jeopardy of being pulled away from the bone, my bicep will reflexively shut down to protect itself. And this is, to my knowledge, the only basis that we have for post-traumatic stress disorders, aside from maybe injury from a concussive force and things like that, different frequencies of a bomb explosion, for example. But in situations where our right frontal lobe has been pushed past its capacity, we would expect it to shut down, but in some situations it's not able to. Just like a football player might exceed his capacity and pull the muscle from the bone, a very traumatic event may damage that right frontal lobe and produce a PTSD type syndrome. Anyway, that's kind of a rough view of the theory, and you can read more about it perhaps in Psych Bulletin here with Carmona from our laboratory. So once again, the IRB and our ethical guidelines put research limitations on our study of emotion. You must be free to withdraw. It must be minimal risk. So the science that we have on emotion is quite limited. I might even argue that it's inadequate because it's only looked at mild to moderate stress. But life has no limitations. Life often brings extreme stress, and in some situations we have pretty clear evidence that that stress can damage brain tissue. So here's an example of some clinical tests of capacity theory. We offered these to the World Congress of Neurology in Rome, Italy, the other day, and received the research award for best paper at that conference. And we had an undergraduate like you guys in the laboratory who was part of that project, and so she got that on her vita, and I think it helped her get into medical school. But here we're looking at a patient that has a lifelong stuttering problem, which we would call a Broca's aphasia, a non-fluent aphasia, halting, hesitant, effortful speech. But we're looking at the electrical activity of his frontal lobe. The odd numbers you may recall in the electroencephalogram refer to the left frontal region. So this is, both of these electrodes are over the left frontal region. And as we go from a quiet situation, looking at delta, our primary measure of pathology in the brain, I think you can see that when he begins to talk, exceeding the capacity of this frontal region to do what it's supposed to do, his left frontal lobe shuts down and goes into extreme delta, a very pathological state, what would be very deep sleep for your brain tissue. And here we're looking at a homologue for this area in the right brain. The right frontal lobe keeps your fear under control. It keeps your tachycardia and sugar levels under control, your cholesterol under control. But different circuits for anger, sadness, and fear. But here we have a patient with uncontrolled, unbridled panic attacks when you talk about her doctors. Why? Because she was just having her baby, but she was injured in the hospital with too much anesthetic during that process. And she won the lawsuit. In fact, they doubled her attorney's request for damages based upon negligence claims. But what happens as we go from baseline, a relaxed quiescent state, as she goes into a panic state? Now, the red reflects electrical activity over the left frontal lobe and the blue over the right frontal lobe. And as she goes into a panic attack, both frontal lobes are having difficulty here, but it's primarily almost a doubling of the amount of delta activity over the right frontal lobe. Her right frontal lobe shuts down and leaves the back of her brain unbridled, in a panic state with tachycardia, profuse sweating, glucose mobilization into the bloodstream, cholesterol mobilization into the bloodstream. And I think you can appreciate that now we're talking about health-related variables. If you have maybe problems in this circuit in a chronic basis, or if the stress is chronically being exceeded, then we're looking at maybe long-term health effects. So when I came to Virginia Tech, I had been working almost exclusively with non-human primates, with monkeys associated or affiliated with the Yerkes Primate Center down in Atlanta, Georgia. I was at the University of Georgia, of course, but I was also doing rat research and so forth. But coming to Virginia Tech, we didn't have those primate laboratories available, and so I needed to make a shift in my research as well as get the job. So I was trying to think of what would be the best line of research, and I appreciated that all of the psychologists in our program here at Tech have interest in health. And then when I looked at the largest literature in health psychology, it was on hostility, or a cynical view towards others, a desire to see other people harmed. Well, there are certainly reason to believe from our literature that hostility is the best predictor of cardiovascular disease. You'll hear people say obesity and other types of things, but we find that the metabolic syndrome is also predicted by hostile, cynical view towards others, a defensive posture, chronic state. So I decided I would do my research on hostility, but looking at that literature, I realized that not a single person in psychology or the medical fields had looked at the brain function, the neuropsychology, the neural systems behind regulating your blood pressure, your heart rate, your glucose, your cholesterol, and anger or hostility. So that's what I decided to do. So here's an example of just typical findings in our lab in terms of controlling cardiovascular functions. Here we have low hostiles in blue, and we have high hostiles in red before and after stress. The most common stress in this literature is to put the arm in ice water. We call it a cold pressure stressor. It hurts. But I think you can see when low hostiles experience that pain, they maintain control of their heart rate, whereas high hostiles lose control of their heart rate. There's a significant increase in heart rate. And again, we replicated this umpteen times. We don't always replicate it, but almost always replicate it. When we look at systolic blood pressure, once again, this is just a sample of our findings, but low hostiles maintain control of their blood pressure as they go from baseline to a post-stress state. High hostiles lose control of their systolic blood pressure from the pain. They're unable to regulate sympathetic drive. So to make a more real-life example for you, you may have had the distinct pleasure of being around this fella when he's having a tantrum, okay? And there's hardly anything worse than an angry baby cry, in my view. But what happens to our low hostiles when they're exposed to an angry baby cry? They maintain control of their systolic blood pressure and heart rate. High hostiles do not, okay? And you can imagine that we have concerns now if the capacity of the right frontal lobe in our high hostile folks is exceeded with this emotional stressor, that there might be an increased risk for the child too. So we have more interest, broader interest down the road. Here we're looking at systolic blood pressure, and again, high hostiles lose control of their systolic blood pressure. But looky here, and we find this, not always, but we find this sometimes with our low hostiles, is that negative emotional stress, like a baby crying angrily, actually lowers their blood pressure. We find that left frontal activation in these folks sometimes, where they have approach-related emotion to be nurturant and kind and supportive, rather than wanting to harm the child, perhaps. with sympathetic drive. And by the way, our science from our laboratory and more broadly, substantial support for the finding that the right brain is largely involved in sympathetic drive. We talked about this earlier. High heart rate, high sugar levels, high cholesterol levels, whereas the left brain is associated with quiescent states like digesting your food, visiting with a good friend, a little bit of positive emotion. Here we're looking at blood glucose levels now, and you may have family members with diabetes and things like that, but what we find is when we put the right frontal lobe under stress, and our best neuropsychological stressor, aside from pain, is actually design fluency. How many unique designs can you draw per unit time? Whereas our primary measure for our stressor for the left frontal lobe is how many words can you produce per unit time. So if you can imagine trying to produce unique words under confrontation, stresses the left frontal lobe, and producing unique figural designs stresses the right frontal lobe, you can see that high hostiles are having a lot of difficulty regulating their sugar level just drawing unique designs. You wouldn't even think it was stressful for you, okay? But that's a dual task, trying to produce those designs under confrontation. And by the way, we universally find that our hostile violent prone folks here at Virginia Tech, and out of every 200 students here at Virginia Tech, we have data to suggest that 15 of them are potentially CHOs. Yeah, they need to be respected. They demand substantial respect. People think they're insensitive, but our science shows that they are substantially more sensitive than other people, okay? But they routinely perform in the pathological range on standardized tests looking at right frontal function, nonverbal fluency. So that's a clue. Now, again, people tend to have attributions that hostile violent prone folks are insensitive. And we do find that they tolerate pain significantly higher levels than other people. They tend to be very competitive. They will beat you in different types of competitive tasks or activities, maybe more important to them. But when we look at pain ratings now, we find that they are experiencing significantly more pain even though they're tolerating it. So at this point now, I think you have a little bit of idea of hostility, violent prone folks, and how they have strong evidence of poor regulatory control over their sympathetic nervous system, cardiovascular function. So what I wanted to do now in this line of research beyond that was to conduct a neuropsychological evaluation on them. And so in giving this presentation, I'm hoping that you get some idea of what a neuropsych eval is like. It's not just a bunch of standardized tests. We're looking at specific brain systems and what you're able to do. Okay, we're manipulating reflexes and things along those lines, cranial nerves, etc. But what would happen is instead of doing a neuropsych eval on a single individual, we took groups of hostile, angry, violent prone folks and did a neuropsych eval on the same group each time. In other words, they're different groups over the years, but they meet the same hostility and violent prone criteria. Okay. So one of the first things that I would do in a neuropsychological evaluation is evaluate arousal level, our first functional unit, the brainstem reticular activating system, the sleep arousal systems, largely in the brainstem. And here we're doing quantitative electroencephalography. We're measuring the electrical activity in the brain again. And what we find is that hostile violent prone folks in a laboratory setting that's not threatening or anything is that they're actually under aroused and they have relative activation of their right brain. Okay, let's take a look at it. So here we're looking at beta power, and you remember beta is high frequency activity associated with high arousal states. And we find that our high hostile folks here in red are significantly under aroused, but especially in their left hemisphere, the left side of their brain. Okay. So this is actually interesting because when we look at sociopaths in the classic literature, they were always described as being under-aroused. And the under-aroused sociopath was described in the classic literature as having stimulus hunger, looking for thrill. That didn't last very long, but criminal activity, stealing behavior, harming somebody else, etc., was a brief elevation in arousal and then recovery to an under-aroused state. Just an interesting comparison there. I don't know if it's valid. So here I'll remind you of the different areas of the brain: vision in the occipital lobe, audition in the temporal lobe, somesthesis in your parietal lobe, motor function in your frontal lobe, etc. But with our electroencephalogram, our EEG cap on, we're measuring the electrical activity across the entire brain here, and I've tried to give you a hint at what these electrodes are looking at down below. So these are over the occipital lobe, these are over the parietal lobe, these are over the temporal lobe. But across these different electrode sites, again, high hostile folks are under-aroused using electrical activity in their brain, the EEG, when compared with low hostile individuals. So in my neuropsych eval, next, I might move to the orbital frontal region. Excuse me. And I'll remind you that this region is connected via the uncinate fasciculus to the amygdala. And Delgado was trying to manipulate this system in his bull. But this region is most associated with irritability and anger-related behavior, as well as sympathetic drive, increased blood pressure and heart rate, cholesterol, and glucose so that you win the fight. The cholesterol keeps you from bleeding out if you get cut. So here we're looking at the electrical activity in the orbital frontal region. Again, we're looking at delta this time as a relationship to pathology. And what we find are high hostile folks have significant delta activity in both orbital frontal regions, okay, compared with low hostiles. So the conclusions from our arousal evaluation, and I'm just giving you a sample of some 200 research projects that we've published in one form or another. The conclusion, if they're under-aroused, is in different parts of the brain, they may not see the world like others see it. They may not hear the world like others hear it. They may not feel the world like normal folks either. And maybe most importantly here, their regulatory control of emotions may differ. So in this neuropsych eval now, continuing the arousal investigation, as a neuropsychologist, I might investigate their startle response. The startle response is one of our primary neuropsychological measures of cingulate function. So, for example, if I made a loud noise right now, some of you might jump a little bit, and then by the second or third time, ignore it. But some of you instead might jump significantly. It might scare you. We had a secretary who, with a simple little noise, would startle so abruptly that she would be on the floor and we'd have to pick her up. But an exaggerated startle response indicates that the cingulate is not working up to par. Now, your startle response will vary. And so the activity of this system varies over time. It's a very dynamic brain. So maybe if you're a little bit sluggish this morning, that startle response might have been a little bit more exaggerated. But it's also our primary clue for a lesion or damage in this system. And by the way, this system activates in every fMRI project. And so people that have very little experience in the brain attribute all kinds of functions to this cingulate gyrus that is certainly revealing. So let's take a look at the startle response in our high hostile violent prone folks. Okay, going from pre-stress, before a cold pressor, and after the cold pressor, you can see that the high hostile individuals have an exaggerated startle response. But also, when we repeat the test, our high hostile folks are not habituating. So the cingulate gyrus, if it's not working well, we have difficulty habituating to environmental changes, novelty, or saliency. And so we might, for example, move you into your dormitory, and you might be quite discomforted the first night or two. But if the good frontal lobe function, you'll habituate to your environment and it'll become home. But with problems here, we're finding that our high hostile folks do not habituate. Our low hostile folks have a reduced startle response, and it habituates across time. Here we're looking at habituation of sympathetic drive by asking our folks to just simply contract their corrugator muscle. Now, the corrugator muscle is your frown muscle. If you make a frown right now, right between your eyes, you'll have your corrugator muscle contracted. Well, it turns out that just contracting that muscle activates your sympathetic nervous system. So when you made that angry facial configuration, your blood pressure went up, your heart rate went up, and your galvanic skin response went up. We talked about this under methods. It's our number one measure of sympathetic drive, and one of the most commonly used measures in psychophysiology. Okay, so here we're looking at just contracting that muscle and what happens to our high hostiles' sweat, our galvanic skin response at their left hand. It goes up, and they don't habituate on the second trial. They do habituate their left brain, controlling their right hand sweat. And our low hostile folks are just the opposite. They habituate with their right hemisphere, left hand, first, and have a little bit more difficulty with their happy brain habituating. Okay. So be cognizant of your facial expression, and it's therapy. No kidding. If you would contract your zygomatic muscle, just simply make a smile for me, lift your lower face up. That just lowered your heart rate. I'm not kidding. It lowered your blood pressure, it lowered your heart rate, and reduced your sweating, so you'll smell better. People will like to be around you more. But simply contracting the corrugator muscle activates your right brain and sympathetic systems. In the neuropsych eval now, I might go to the visual system, and you'll remember one area that I wanted you to know was the fusiform face area for localization. The right brain, our literature suggests, is specialized for processing emotional faces, but the left brain adds a detailed analysis, a sequential analysis of a face. So they're both working, but in different ways. But the emotional brain here is where most of our science is on facial emotion. So let's take a look at it. Here I'm showing standardized emotional faces. These are Ekman's faces. They're very popular, and they differ in emotional valence, but we control different things too, like whether or not the mouth is open or closed, those types of things. But in this particular project, we're just looking at angry face recognition and happy face recognition. And what we find is that our hostile violent prone folks are having problems with their right brain. So when we look in the left visual field, you remember visual information in your left visual field goes to your right brain. And our high hostiles are significantly less accurate at recognizing emotional faces than our low hostiles. We have almost perfect performance from low hostiles. And we find that both groups are having trouble using their left brain to recognize emotional faces. That's not what it's made for. So if our high hostile folks are inaccurate at recognizing emotional faces, then what are they seeing? What kind of errors are they making? So in this project, what we did was insert a neutral face every now and then. And it was forced choice. There was only a lever to identify the face as angry or happy. But every now and then, unbeknownst to our subjects, we slipped in a neutral face like this fella here. And what do they see? If the neutral face is in the left visual field, pardon me, and goes to the right brain, they see almost all the time an angry face. So they have an angry bias perceptually. They see the world differently. A neutral face is an angry face. When it goes to their left brain from the right visual field, no problem. So this negative emotional bias that we found for visually presented faces, we also found for the tone of your voice, for your posture, etc. So regardless of the sensory modality that we're looking at, hostile violent prone folks have a negative emotional bias. I encourage you to be very respectful with them and realize that they're seeing things a little bit different from you. Okay? So in our neuropsychological evaluation then, after doing visual assessment, I might do some auditory assessment. You remember the cable from your inner ear, the statoacoustic nerve, auditory nerve, projects here to Heschel's gyrus and then expands out into the association cortex to be comprehended, where the left brain comprehends logical linguistic speech and the right brain comprehends prosodic content or emotional tone of voice. So here we're looking at the number of left ear auditory events that are detected in a situation where both ears are getting sound. So does the individual, when they get sound in both ears at the same time, do they hear with their left ear or do they hear with their right ear? And when we're in a baseline quiescent state, we can see that hostile violent prone folks look an awful lot like normal folks. But after putting them in pain, the cold pressor test, they activate their right brain and shift to a left ear advantage. Now imagine mom in the grocery store and the kid's getting in trouble and mom shouts at the kid. Well, balance theory says that will activate the child's right brain, which will inhibit their logical linguistic speech processors in the left brain. So a loud, screaming, nasty tone of voice in the person is less likely to hear what you're saying. That's balance theory. But our high hostile folks are activating their right brain with pain and hearing with their left ear, which suggests they are not processing logic. Our low hostiles instead activate their left brain and they shift to a right ear advantage. They're more likely to hear the logic, the rationale, the linguistic components, and the positive aspects of the emotion. So now in our neuropsych eval, I might look at the frontal lobe, especially around the frontal eye fields. And so the frontal lobe intends. Anytime you hear somebody use the word intends, or he did something intentionally, you should think of the frontal lobe for a neuroscientist. But the right frontal lobe intends to the left hemispace and to your left hemibody. And so here we're asking our subjects to focus. This is a dichotic listening study again, like we just talked about. They're getting sound in both ears at the same time, but we're asking them to focus either on the left ear or focus on the right ear. So we're using some of the capacity of this right frontal lobe or left frontal lobe to focus the intention. And here's what we find for heart rate, sympathetic drive. In our hostile violent prone folks, when they shift their focus to the left ear and they use the capacity of their right frontal lobe, they lose control of their heart rate. Now, you would think that would be the easiest thing in the world for you to do, but you have quite a bit of capacity in your frontal lobe. With minimal capacity, shifting your intention to the left ear allocates resources for that and takes it away from keeping your heart rate and blood pressure under control. No problem for the low hostiles in black. In fact, focusing to the left on the low hostiles, really good control of their heart rate. Now we'd move to the vestibular system, perhaps, in the neuropsych eval, and the statoacoustic nerve from your inner ear. The auditory part or acoustic part carries sound from the basilar membrane, but the vestibular part, static part, carries information from your vestibules, your semicircular canals in your inner ear. But that nerve carries both of those modalities up through the cerebellum, brainstem, up to the temporal lobe. And so if the right frontal lobe is down, we expect a leftward vection. And if the left frontal lobe is down, we expect somebody to be dizzy with a rightward vectional complaint. Okay? That's straight from your laboratory here at Virginia Tech. We discovered that. But let's take a look now. So here we are with our hostile and non-hostile folks, hostiles in red again, and we're doing a very, very mild stress. The focus here was not producing vomiting in the laboratory, but we, just like NASA would do, we put the subjects in a chair and they were spinning very slowly to the right, and when we stopped spinning them, okay, we're looking at galvanic skin response here, sweating, skin conductance, our primary measure of sympathetic drive. Our hostile violent prone folks lose control of sympathetic drive. So they're significantly more sensitive to vestibular stress than low hostiles when it involves the right frontal lobe. But they're not good with either frontal lobe generally, especially the right. Now let's move to facial motor control, and you'll remember the motor homunculus here. Your face is located down at the base of that homunculus. Above that's your right arm in this case, and your right leg. Left hemiface, left hand and arm, left leg. Okay? Now, if you saw somebody with a stroke in their right frontal lobe, maybe 6 months down the road after being paretic initially or paralyzed initially on the left side of the body, then those lower motor neurons will produce spasticity. And it's an anti-gravity spasticity. So with a right frontal lobe upper motor neuron lesion, the hand will be flexed in a grasp reflex, and the left arm will be curled up, and the right leg will be extended, anti-gravity posture. But you would say that person had a stroke or they had brain problems. But when you see somebody with a facial dystonia or facial spasticity, we find that our students and faculty here at Virginia Tech say, I don't like that person. So this is a real social disability. And these are sensitive people. They will know that you've had a negative reaction to them within a heartbeat and that you don't like them in a heartbeat. And that aggravates our risk as society and increases their risk for violent behavior. They demand a lot of respect. They are not insensitive. Our theory and our findings suggest they are significantly more sensitive. But now, here we're predicting that with the angry, violent, prone behavior, that there will be upper motor neuron problems, especially in the right frontal lobe. And we're looking at electrical activity in facial muscles. And what do we find? This is the left hemiface, and this is the right hemiface. Hostiles in red again, but we're going from baseline to cold pressure, pain, stress, to recovery. And I think you can see that we have significant dystonia or facial spasticity on the left hemiface here. Both sides of the face are spastic, but especially the left hemiface, as we predicted. Low hostiles also have more facial expression on the left hemiface than they do on the right. And when we look at people posing for photographs, we will almost universally express our left hemiface to other people's so that they can get the best view of us. The right side of your face is more flat, less interesting as a group. Not for everybody, but that's in our group studies, that's 8 out of 10, at least, to be statistically significant. Now, we just looked at the facial region. Let's go up and look at the hand region. And again, if we're having problems with the upper motor neurons in the right frontal lobe, then we should have increased flexor strength in the left hand. And that's what we find. Hostile, violent, prone folks are significantly stronger in grip strength at their left hand, significantly weaker at their right hand than low hostiles. Okay, all right. But now, what would you predict, now that you know the theory, if we were looking at a bench press instead of grip strength, where we're looking at extension of the left arm? Well, at the hand with flexor dystonia, we expect increased strength at the left hand for flexion, and that would be true for the left arm for flexion. But when we look at extension of that arm, we'd expect them to be significantly weaker. So here we're putting stress on this tissue by asking the individuals to grab a hand dynamometer and squeeze it as hard as they can. So squeezing the left hand here uses the right frontal lobe's capacity, and it reduces its ability to regulate sympathetic drive. So just squeezing with their left hand, their blood pressure goes up significantly. Squeezing at their right hand affects it too. So both frontal lobes are having trouble, but significantly different from their baseline. What happens when we ask low hostile individuals to squeeze as hard as they can with their left hand, squeeze as hard as they can with their right hand? They have plenty of capacity to squeeze with their hand and maintain control of their heart and their glucose and their cholesterol. So we're gathering substantial amount of evidence that the frontal lobe, especially right frontal lobe, is at risk in our hostile, violent, prone folks, and that means health problems, cardiopulmonary disease, heart attacks, high cholesterol, metabolic syndromes, those types of things, diabetes. So Here in the neuropsych eval now, we might look at Broca's area in the left brain by measuring verbal fluency again. I think I mentioned earlier that verbal fluency standardized tests are the number one measure that the neuropsychologist has for the integrity of this region. And the number one measure that we have for the integrity of the homologous region, the same region in the other brain that doesn't talk, is design fluency. How many designs can you produce per unit time? Unique designs. So these are stressors for us now. Let's take a look at these measures though. So you may recognize this painting and you might pay $1 million for it. I would not. This is just simply a right frontal lobe brain disorder. How do I know? Because these are perseverative designs. And this gentleman, retrospectively, of course, I never saw him. I think he cut his ear off. But you can appreciate with right frontal lobe problems, this gentleman had a lot of violent behavior. He cut his ear off, as my art teacher in the 6th grade taught me. But also in reading about him, one author describes him being shot by his lover. And his dying words, according to this author, to the sheriff was to not blame him. Don't blame my lover. Okay. And I inserted the word lover, but it was apparently a homosexual relationship. But he didn't want his fellow to be blamed or penalized for shooting him. But regardless, there was evidence of violent, aggressive behavior here. But this is one of my patients, okay? I'm not going to pay $1 million for his drawing of a clock either. But he's trying to draw a clock, and it becomes highly perseverative in the design. The same patient now is trying to copy Luria's ramparts up here. And with a right frontal lobe problem, he starts out good and then starts to perseverate on the designs. If it were in Broca's area, the perseveration would be on the phonemes. What's your name? David. Okay. Homologous area in each frontal lobe. So let's take a look. Here we're looking at design drawings. How many unique designs can you make versus how many unique words can you produce? Well, we have a floor effect. Both of our groups were not showing any errors on the verbal fluency task. Okay, but when we look at the design drawing task, you can see our hostile, violent, prone folks are making many perseverative errors. And again, when we give these standardized tests, our hostile, violent, prone folks, now these oftentimes very successful people, very competitive, students that are doing very well here at Virginia Tech, 15 out of every 200 of you, okay? But they are in the significantly impaired range, the pathological range on standardized tests of design drawings. There's also, I don't really have hard science, but anecdotal evidence that they oftentimes doodle with perseverative designs in office meetings where people are angry and stuff like that. Here we're looking at perseverative errors across 5 different trials of a design fluency test, and our low hostile folks make very few perseverative errors. Our high hostile folks make a lot of perseverative errors, especially after pain or after stress. Here we're looking at blood pressure again, systolic blood pressure, and the stressor that we're using to stress the left frontal lobe is verbal fluency. The stressor we're using to stress the right frontal lobe is design fluency. And what happens to heart rate and blood pressure when a hostile, violent, prone person has to produce design drawings under confrontation? Again, they make many perseverative errors, but they also lose control of their blood pressure and their heart rate and their sweating and sympathetic drive. Their glucose is mobilized, etc. Low hostiles instead, with reduction Okay. I'm sorry, that's not low hostile. These are high hostiles too, but this is verbal fluency. So we can send blood pressure up or down in hostile, violent, prone folks. We can activate sympathetic drive by doing design fluency with right frontal lobe stress. We can lower sympathetic drive by doing verbal fluency, just simply producing words. And if we made the words happy, we get significant lowering of blood pressure beyond that. So in our neuropsych evaluation now, we also looked at anger in versus anger out with verbal fluency and design fluency, but I don't have those results in here for you. Now let's go to the prefrontal. I think most people call them the frontal eye fields, okay, but it's prefrontal brain cortex. This area, when activated, will move your eyes to the right. And in the right brain, the frontal eye fields will move your eyes to the left. Okay. But this right frontal eye field keeps you from being distractible and having a saccade to the ipsilateral side. So it moves your eyes to the left, but it keeps you from looking at irrelevant information to the right. And this one moves your eyes to the right, but it keeps you from being distractible to the left. So, for example, if a kid is distractible in class, the neuropsychologist wants to know which side are they distractible to. If they have right frontal lobe deficits, they will be distractible to the right or ipsilateral side, and we can reduce distractibility by putting their desk up against the right wall in the classroom. Or we can do therapy by putting them up against the left wall in the classroom and have them doing visual motor exercises. Anyway, you get the idea, visual smooth pursuit. So here we are measuring the electrooculogram for visual smooth pursuit. They're watching this dot move back and forth across here with their head fixed. And these are the electrooculogram we talked about before, measuring muscle action potentials. And we're expecting our hostile violent prone folks to have a lot of visual smooth pursuit errors, what we call nystagmus or jerky eye movements. And that's what we find. Hostile violent prone folks have right frontal eye field and left frontal eye field deficits. Visual smooth pursuit is difficult for them. Now let's move in the neuropsych eval to learning and memory. Your left hippocampal and parahippocampal system processes verbal learning. Your right hippocampus and parahippocampus processes emotional learning, non-linguistic emotional learning. So here's an affective verbal learning test. I'm not giving you the whole thing here. I'm just giving you part of it. It's a very popular test that we developed, and it's used in a lot of laboratories and used clinically too. But these are standardized word lists. They're standardized for their rate of occurrence in the English language and the intensity of the emotion. So if you would please read out loud the positive words in this list: smile, joy, happy, cheerful. Your blood pressure and heart rate just went down. Your sweating just went down. It's therapy. Parasympathetic drive is accentuated by just practicing or rehearsing this word list. Let's do this one now. Please read out loud: murder, kill, cruel, hate. We just had significant changes with elevation of your sympathetic drive, increased heart rate, blood pressure, and sweating. And if we use neutral words, again, we lower blood pressure and heart rate, but not as much as if they're slightly positive. Okay, so these are different word lists with different affective valences. Let's see what hostile violent prone folks are able to learn. When we look at neutral words, hostile violent prone folks have a learning disability. They're significantly impaired. When we look at positive words, hostile violent prone folks have a learning disability. They are impaired in recalling positive words. But when we look at negative word list learning, no deficits whatsoever. So society wants psychologists to be good with these folks. They want us to help them get straight so they won't be harming themselves or others. And so they try to get mental health facilities set up so that there are resources available. Now, we go see the cognitive behavioral therapist using verbal therapies, and we ask, can they remember what's been discussed with the therapist? If it's neutral, significantly impaired. If it's positive information, significantly impaired. What do they take home with them? They take home any negative content. And a first-year clinical student makes a lot of screw-ups sometimes, and one of the first things they'll say with a court referral from the judge of a hostile, violent, prone person, so you were referred here for anger problems. What makes you angry? So now we have perseveration, right? That's a frontal lobe problem. Perseveration on negative emotions, that's a right frontal lobe problem. And that patient will leave and hate the therapist, perhaps. So the question arises, if we're supposed to be so good as psychologists seeing these folks, how many sessions do we get with them? How much time do they spend with us? I don't have hard science on this. I want to get it. I only have kind of anecdotal and experiential types of things. But my best estimate, best informed estimate here, is the clinical psychologist has less than 1.5 sessions to deal with this problem. And it's quite reasonable that the clinical psychologist will make it worse. And the judge, hostile, violent, prone people, and the right brain in general is very sensitive to coercion, feeling that someone else is making you do something against your will. That activates your anger circuits. And so forcing someone to go to mental health therapies has some contraindications that are problematic. So when we look at right brain disorders from strokes and things like that, the number one problem associated with a right brain disorder is that the patient has anosognosia and anosodiaphoria. What is that? It means they don't have insight to deficits. So what does the right brain make its attributions to? It makes its attributions to things in extrapersonal space. Right brain says, I don't have a problem. You're causing the problem. That's the basis behind anger and fear. Someone else is doing something bad. It's not me. Okay? But in a hospital, the hostile, violent, prone person, but the right brain damaged person will typically tell their family, I shouldn't be in this damn hospital. I shouldn't be doing these silly therapies. I should be back on the job. Get me out of here. Whereas with left brain disorders, especially left basal ganglia, everything's wrong with me. Self-critical concern, I'm no good, et cetera, et cetera. And that's balance theory again. But let's take a look now. These are college students at Virginia Tech. And I did not do a good job with the methods. Don't think that I did. But in every project that we've done in this line of research, when we're finished, we debrief them and we tell them what the experiment was about. And then we ask them, okay, which group do you think you were in? Our low hostile folks are 90% accurate that they were in the low hostile group. Our high hostile group, they don't have a clue. They think they're in the low hostile group too. Insight to deficits. It's one of the major things we deal with in a rehabilitation setting with right brain disorders. Patient does not have insight to deficits. So they will tend to get up out of their wheelchair and fall, not appreciating their safety deficits. They will choke on their food, not appreciating their dysphagia, et cetera, et cetera. They'll get in an 18-wheeler and drive behind your car and kill your children. They will go home and cut down a tree on top of their house and kill their son. These are patients of mine. Not appreciating they have a deficit. They will go to the golf course and not be able to hit the ball, and they will be blaming other people for the problem with their equipment. Some concluding remarks here. Hostile aggression is not simply socialization. The brain functions differently. So in this neuropsychological evaluation, it's not on an individual, it's on similar groups. But if this were an individual, I would definitely be diagnosing a brain disorder, primarily right frontal pathology, but bifrontal deficits. So with right frontal lobe problems, we're going to have dysfunction in the autonomic nervous system regulation, especially for sympathetic drive. We're going to have diminished learning of positive or neutral information, and maybe well-established recall for negative or angry information. Here's quadrant theory now. Remember, it starts out with balance theory, where if the right frontal lobe goes down, we expect a release of the left frontal lobe. If the right frontal lobe goes down, we expect a release of the perceptual systems in the back of the right brain, etc., etc. Okay? And now we have diagonal relationships that we can account for. So with decreased or downregulation of the right frontal lobe, we expect diminished regulatory control of the sympathetic nervous system. That's increased sweating, increased blood pressure, increased heart rate, increased glucose mobilization, increased cholesterol deposition. And poor social pragmatics and proprieties, taking turns, appreciating that you shouldn't be screaming at the poor person making your hamburger at McDonald's because they left your pickles off, okay? Those types of things. You shouldn't be shooting the bird at people driving down the road. You shouldn't be honking your horn at them at the intersection. So with it right frontal lobe down, then we expect increased activation of the back of the right brain. That gives us a negative emotional bias. Learning of negative content is accentuated. Attribution of blame to others, not to ourselves, and generally activation of our negative perceptual systems. With increased activation in the left frontal lobe, we have regulatory control of the parasympathetic nervous system is good. So efforts to produce a quiescent state are not going to work well. Social approach with anger. So we activate social approach, but the emotional bias is anger. Rapid initiation. Remember, your left brain is a very rapid sequential processor. So initiation without caution, getting out of your wheelchair and starting to walk when you have paralysis on the left side of your body. And a self-righteous view that when you harm another person, it's a principled act. You're yelling at the person at McDonald's for not putting the pickles on there because you want them to do a better job for everybody. Aren't you a good person? And then you can take a look at the predictions down here. So when we apply this theory, we're batting 1,000 thus far, but our research thus far in the laboratory has primarily been on cardiopulmonary system and glucose. We haven't looked a lot at perceptual processing of emotion over here. Suggests that we should define stress differently. Psychologists have a bullshit literature on stress based upon Selye's theory in the 1950s, and it is hogwash in terms of what we know in today's psychology. We know that stress should be defined by which functional neural system has been stressed. Some of your brain systems are designed to increase your sympathetic drive, and some are designed to decrease your sympathetic drive. And so stress should be defined on which system is stressed. You'll recall with our hostile violent prone folks, if we stress their left frontal lobe, we lower their blood pressure, heart rate, and we absorb their sugar from their blood. for digestion processes. Whereas if we stress the right frontal systems, we increase heart rate and blood pressure and mobilize glucose. Here's a little pop test. See if you can recognize the emotions. This is my dog Bear and my cat Riley. Expressionless, right? Yeah, sad little puppy. Oh. Anyway, thank you for your patience in going through this. Bye-bye.